Hello and welcome to NHIS in a Week. In this week's edition, NHIS members who are 70 years and above will now enjoy a waiver of the 1-month waiting period after registration or renewal. The board and management of the authority embarked on a 2-day working visit to the Ashanti region. Project 1,000 Kids launched to register more children onto the scheme. Team NHI grabs 2 trophies at the City Business Olympics. To our first story, a major policy to waive the 30-day waiting period for persons of 70 years and above has commenced, beginning this month, September. The CEO, Dr. Okoboy, announced this during his working visit to the Ashanti region.
Today, we are happy to announce that the President, the Ministry has charged us, and we have met as a board and approved. At 6 p.m. from today, 26th, anyone who is 70 years and above, the same day that they register for insurance, the same day they can go to hospital with their insurance. This became necessary because reports came to the Minister of Health, came to us, that some elderly people go to register. In fact, they go to the hospital first for care. Let's say an old man with diabetes, 80 years. And then they tell him, oh, Oluman, either you pay from your pocket or go and register with insurance. They walk to the insurance desk, they get their card, they come back, they say, oh, Luman, you have done well, but this will start working after 30 days. And then these elderly senior citizens get into trouble. So, with inspiration from the President and the Minister, we at Health Insurance are happy to announce that from 6 p.m. today, any 70-year-old and above who registers with health insurance gets instant access the same time they registered.
The National Health Insurance Authority has launched a new innovative intervention project to encourage more children to be registered onto the National Health Insurance Scheme. The project 1,000 Kids seeks to readily register a total of 1,000 children under the scheme with an amount of 6,000 per sponsor. It is also to encourage individuals and corporate bodies to come on board and to support the registration of 1,000 kids at a go onto the scheme. The Ashanti Regional Minister, Honorable Simon Osei Mensah, launched the initiative. Here are a few excerpts.
I was with the board chair, the middle belt operations officer, and then the regional director. So I had some briefing about this 1,000K project, which we want to launch today. It's a very laudable project, and if all of us will put their hands on the wheel, I'm very sure that whatever we want to achieve will be possible. We will give you all our support. Doc and CEO, I'm giving you all the assurances of the Regional Coordinating Council that we support the project. Whatever we will join you to do to make it a success, we will do.
There's good news for children in the Ashanti region with 1,000K. There's good news for elders across the country. The government is working hard, and it is my prayer that we all support to make sure that at least when it comes to health care, we can all walk to the hospital without the fear of having to take money out of our pockets.
As part of the working visit of the Ashanti region, the board and some management and staff visited the Ashanti Regional Office of the authority.
So this one, if you're a man and you come and angry, you'll be angry the whole day. At least so put at least one beautiful face inside. Anyway, so for the policies now, everybody, including drivers, everybody should be. There might be some few challenges, opportunities, but typical of every branch of an organization, there would be by all means some situational reports or occurrences which we from the headquarters should be apprised of.
The team also visited the Kumasi Claims Processing Center, CPC, and the Asokwa District Office.
We have 5 sections here, and our core mandate is to receive claims, process them, and recommend payment for services rendered by our health facilities, our credential health facilities, to our members.
The CEO, in acknowledging some challenges facing staff of the authority, he has assured them of his relentless efforts in addressing them. He added that he was working closely with the board to significantly deal with the issues to make operations better than ever. The CEO said this at a dinner meeting organized for NHI's district managers, drivers in the region.
Someone said that sometimes when your card expires, there are issues. I think from MIS, one of the things we do is that we'll get the Ghana card numbers of everyone in this organization. Your registration should be automatic, and we must bear the cost. Yes. I think it's not excusable for a staff some way somehow to cross the expiry date and forget to renew. But since we don't want to also come and tell you how come you forgot, it's better for us to find a way to get you in by force.
Ashanti will continue to play some significant role in the overall development of the NHI. It is by the dint of hard work of all of us, the drivers, the district managers, and even the lowest rank staff at the district. It will interest you to know that despite all the myriad of challenges last year, Ashanti region exceeded a target of 104% in active membership. Thank you so much.
Moving on, the board chairman of the National Health Insurance Authority, Dr. Ernest Kwaku, hosted some board members in a cross-section of management for some team building and bonding activities. The event took place at Lakeside Bosomtwe in the Ashanti region and was a combination of sharing ideas, playing games and socializing among others. This followed a series of high-level board meetings to improve the performance of the scheme. To our final story, Team NHIA finished the 2022 City Business Olympics as champions in the men's football and basketball events last Saturday at the Eden Heights Sports Complex at Weja. Here are some highlights of the event.
We are here at the Eden Heights Sports Complex, and as you can see, Team NHIS is fully represented. We've had an awesome attendance. We've had staff from a whole spectrum of districts here. We have Wager office, we have the Adenta office, we have Bawi, and all sorts of district offices present here today, as far as even Adenta and Adan, just to come and show the prowess that we have as the authority. As you all know, we started off about 3-4 weeks ago with a series of training programs and activities, both outdoor and indoor, where we had our soccer team rehearse and practice at a hidden location in Jowlu. It went so well. So far today, we've had a few good games. We've had the NHI ladies winning the volleyball. We are waiting to go on the next round. We have the men's team also doing very well. And it's only early hours.
7 aside. Men's football. Ghana Shippers Authority.
First of all, I must thank the authorities for helping us to be able to participate in this thing. It's something that goes on every year, and it's not easy for you to budget for such a thing. We've got a lot of responsibilities, and this being part, we are grateful.
And I don't care if this is actually an interview because we are here to have some fun. So Lydia, I'm not going to take your space. I'm going to allow you to run your own interview. Enjoy. Thanks, Henry.
So far, the program has been exciting, a lot of fun. Our participation has been great. We are doing well. We added a touch to the whole exercise with a team from WEDA conducting registration for those who came around.
Now this week on Health Tip, we take a look at signs and symptoms of stomach ulcer. Up next is NHI's Tidbits.
Did you know that a member of the scheme who defrauds or attempts to defraud the scheme by conniving with a healthcare provider, NHI staff, or any other person or persons to make a claim for a service which has not been provided, a service which the member does not need but which the healthcare provider purports to have provided, a medicine prescription which the member does not require or which is more than what the member requires, or indulges in any other fraudulent or dishonest act, commits an offense punishable under the law.
And this is how we wrap up this week's edition of NHI's in a Week. For more stories, kindly visit our website on www.nhis.gov.gh. Subscribe to our YouTube channel, NHI's TV, and follow us on all our other social media platforms displayed on the screen. Have a good day.